Hello, I'm Dr. Karanjit Singh Narang. I'm Director of Image Guided Neurosurgery at Medanta Medicity. Today I will be talking about backache, a very common disease in today's scenario, especially after the COVID incident. I will be talking about the basic pathology, the causes and how to treat it. So backache in humans is majorly an acquired disease. There are some diseases of the spine which one is born with which can cause backache, but majority of the time it's a lifestyle disease. We acquire the disease because of our sitting habits, our working habits. Backache was initially about 5 to 7 years ago. We were seeing patients in the age of 35 to 50 years, but after the COVID incidents, the age has gone down. We have started to see patients in the 20s, people working from home are very commonly suffering from these problems. So backache can be of various types. It could be the regional backache, which could involve the low backache, the mid back, or the upper, we call the cervical region. We can divide it into axial and radiating backache. Axial is the pain that occurs only in the back, and the other radiating is when it goes down the leg, behind the leg, or commonly known as the sciatica. Similarly, we have for the neck, we have the axial neck pain and the pain that is we call the radiculopathy or the radiating pain going into the arms. So backache usually starts with the pain. It may be pain along the spine, by the side of the spine, or maybe a burning sensation or a pain radiating along one of the four limbs. It may even come down on the chest wall from behind. So that patient may initially start it having after work or maybe exertion, or sometimes it may start with the early morning stiffness also. So backache is diagnosed by, we need to do a clinical examination of the patient to see which area of the spine is affected, and then we direct our investigations to that area. If it's a low backache, we prefer to do an MRI of the lumbosacral spine. If it's a neck pain, we do for it cervical spine MRI and couple it along with an X-ray, or maybe in elderly we need to add on with the bone density, and then seeing these investigations together we try to make a diagnosis. The treatment option again depends on the disease. If it's the first time someone is having a pain and pain is only axial, not going down the legs or the arms, usually it is treated conservatively. Conservatively means we treat it with some medications to ease the pain off, to relax the muscles, and then physiotherapy plus exercises and lifestyle precautions the patient that follows for life. In case there's a pain that goes down the arms, those may be because of some disc prolapse or maybe because of some tumors, they may require some surgical interventions. In case we don't feel the patient requires surgery but the pain is severe enough or the patient is not willing for surgery, we can give some pain procedures like root blocks, epidural blocks, which can temporarily ease off the pain, and we can put the patient on a rehab plan so that gradually the pain eases off. The precautions are very simple precautions. One is the posture. That is the most common cause. Sitting on a chair, people tend to sit on the chair without support. People tend to recline back. The idea is to have your hips touching the back of the chair once you sit like that. Secondly, as I said, it's because of post-COVID work from home. Everyone is working on a laptop. Preferable to have a desktop with your keyboard at your elbow level and the screen at the eye level. People work with a laptop on a table and their neck is always flexed, and then they complain of neck pain. People work at home with laptops sitting on their beds with the neck totally flexed and working 8 to 10 hours. Again, the neck is the worst affected. And today everyone after work spends 1 to 2 hours on mobile, again with the neck flex. So it's basically a postural problem that begins. We need to attempt on that. Then is the exercises, basic neck exercises we used to do as a PT exercises in our childhood. Those are the ones that are required to relax the muscles and strengthen the muscles.